these standards will include such things as requiring insurance companies to spend 85% of the premiums they take in on actually providing health care. You might say, of course, but it doesn't happen now. Think about it. These companies are saying that if we require them to spend 85% of the premiums they take in on treating you, that would be a hardship for them. But this is the kind of standard that would be imposed under this legislation. Let me think of some of the other kinds of standards just to. Oh yes, there would be more. Emphasis on mental health coverage. Now in New Jersey, we already have mental health coverage and some protection against being denied for pre-existing conditions, but most Americans don't. And so that's the kind of standard that would be in Part 1 of this legislation. The second part of the legislation has to do with those people who are not well served by the system now. When Bishop Riley said 40 million or so, there was some murmuring from the crowd. Okay, let's say it's only 30 million. Let's say it's only 20. Oh, okay. So the question is yes, I can give you a breakdown of the 40 million. The point is, we can argue about how many are uninsured. I can promise you there's another 20 million, whatever number you come up with, there's another 20 million who are underinsured. In other words, their insurance will not cover what they need covered.
What about the 40 million that he
So I can get to some of these questions as they are put to me. And so the point is, there are tens of millions. I'm not going to argue right now about how many that is. It's an unacceptably large number. An unacceptably large number of Americans who are not well served by the system now. And the second part of this legislation would address their needs. Now, these are people who are between jobs, or their company has turned them into a consultant. Does that happen to anybody in this room? They used to be regularly employed, and the company said, gee, now you're a consultant and we don't have to pay your benefits. It could be any number of categories. So the requirement here is, under the bill, what would be created is an insurance store. An insurance store where these people who are currently not well served by the system could go for group rate insurance. It would be a large multi-million person national pool. You can get better rates. It's exactly what small businesses have been asking me for years. Can't you help put my employees in a better group rate so that they don't have to pay, as most small businesses do now, 18% more than if you work for a large business. So this insurance store will have an array of insurance plans. Probably there would be Blue Cross, and probably there would be Aetna, a lot of different companies with a large pool of the insured. They would be subject to these same national standards that all insurance companies are subject to, that I mentioned before. And for people who go to this store because they're not well served by the system now, on an income-based basis, they would get assistance in paying those premiums too, up to probably 4 times the poverty rate. So there would be assistance to these employees, unemployed, self-employed, people who are shopping at the insurance store. It's called, in the bill, it's called an exchange, which I think is sort of an infelicitous term. It's, I prefer, it's easier to understand it as an insurance store. In order to keep costs down, one of the things that would be done in this insurance store is to insert some competition. Because right now in New Jersey, about 2/3 of the insured are insured by one of two companies. Oh, you hear that there are hundreds of insurance companies out there. In fact, from the point of view of most New Jerseyans, there are two insurance companies. It's not a lot of competition. Competition. Well, that's exactly what this does. That's what this store, this company store, this insurance store will inject some competition in the system. One of the plans, and this is what you've heard a lot about, one of the plans in this insurance store would be a government-operated plan.
Why?
And let me finish. In this plan, would you like to hear what the plan does? This insurance plan. Well, okay. Let me just say at this point, some of you might want to be considerate of the other people in the room who do want to hear. So what this plan would offer is very much what the other plans would offer. For the insured person, it would look a lot like Blue Cross or Aetna. It would. This will offer competition from a company that is nonprofit, from a company that is tied to best medical practice, so that it can inject best medical practice into the delivery of medicine, and that this plan will be offered like any of the others in the company store, in this insurance store. My guess is that because it will probably be a little bit less expensive, some people, and probably will offer care in a different way, perhaps a better way than some of the privates. I think a number of people, probably not half, who are eligible for this this array of plans will select it. Will select it. So that's the second part of the bill. The third part of the legislation has to do with Medicare. Medicare overall is a successful program.
No, it's not.
Well, the definition, I'll tell you what I use as a definition to say that Medicare is a successful program. Patients like it, doctors like it, it is efficient, and it is solvent. So that's, and in answer to questions, I will talk more about that. It provides good health care to 40 million Americans. And it works. Now, over the 4 decades that Medicare has existed, from time to time, changes have been made so that it provides better care. For example, it didn't used to cover prostate cancer screening or mammograms or flu shots.
And you call that good?
Over the years, we've added those. That provides better care for Medicare beneficiaries. And there are a number of other things of that sort. From time to time, those upgrades have been made to Medicare. This legislation would make some additional upgrades to Medicare. For example, it would create a medical home. Right now, an awful lot of Medicare patients self-diagnose and then go shopping for a specialist. That adds cost. That's expensive. If there's a medical home where the patient can go, where a doctor knows that patient,